This is Kirk Sinclair, the hiking humanitarian, and I'm sitting in the home of Lynn and Tim Deasy here in Norfolk, Connecticut. And I'm here to talk with both Lynn and with her nephew, Chris Davidson, about Soteni International and Soteni, Kenya. So let's start off with you, Lynn. Could you tell us what the 6 guiding principles of Soteni are, and what compelled you to get involved in this?
Sure. The Soteni International, of our guiding principles, Soteni is actually an acronym. So the S is for sustainability, because we truly believe that if you're going to make an impact on other people's lives, whatever that project is or initiative, it needs to be sustainable, because if you start something and don't finish it or run out of funds, then you've left those individuals worse off than when you started. And it also creates an infrastructure that builds the community, and through that infrastructure, at least we believe that the community then is empowered to take care of their own members. Particularly in Soteni's case, we focus in on orphans of HIV and AIDS. It's the opportunity to better the lives of all of these individuals who are so vulnerable because of this disease. And so through our work, we're able to provide them with the opportunity of good education, nutrition, health resources. And the way we do this is through training and educating individuals. We have a group of individuals who are called the Barefoot Doctors, and these are health workers who go into the homes of the people who are living with AIDS and teach them about nutrition and hygiene. They help the caregivers, and we also go into the schools and teach the primary students and the secondary students on AIDS prevention. And then certainly epidemiology. So we look to replicate programs that have proven successful in reducing the incidence or the severity of AIDS. Networking is a huge part of what we do, and hopefully through working with others, partnering, and we have organizations throughout the entire world that we partner with, that we will be successful. And then the interdependence, and that basically is connecting and enriching the lives of not only those who we touch in Kenya, but enriching our lives as well. And our headquarters is in Cincinnati, and so we take some of the programs that we have on the ground in Kenya and actually replicate them in the inner city of Cincinnati, working with people here in our country who are also suffering from this disease.
And what compelled you to get involved in this?
In the 70s, I lived in Kenya for a couple of years, and absolutely fell in love with the country. Decided to become a nurse and came back to the country, the United States, only thinking I would return to Kenya. Unfortunately, I didn't return until the 90s, and at that point Dr. Vicki Wells, who I had met in the 70s, contacted me, and really we were just trying to figure out what is it that we can do to support the AIDS orphans and empower the communities in a way that would be sustainable. And so in 2003 we were able to found this organization.
Okay, and now I know that you have a program with interns, and Chris was one of the most recent interns to be there. And Chris, maybe you could tell us first of all what OVC is. I guess that took up a lot of your time over there. Can you describe that a little bit?
Yeah, so from May 15th to June 30th, I was an intern in Kenya, and as an intern, one of my jobs was to visit the OVCs, which stands for Orphan and Vulnerable Children. So they're either children who have lost their parents or their parents cannot support them. So I would travel throughout Kenya and visit each OVC, give them money from their sponsor if their sponsor sent money, give them gifts from their sponsor, gave them gifts from myself, and I would sit with them for about an hour and ask a series of about 15 to 20 questions. Any question from what do you eat each day and what are your long-term goals. So I would take these answers and for each OVC and write a report, which ultimately goes to their sponsor just to update them on how they're doing. So in that 5.5, 6 week span, I visited about 50 OVCs throughout Kenya.
Now I understand that another role of yours was to evaluate an IGO. One in particular that I'm a little interested in is maybe the one that has to do with bananas, and both of you could chime in on this, but there is something in place for growing bananas, but there's also some problems that need to be rectified. Can you talk a little bit about that?
Well, first, an IGO is an income generating operation with the idea that you have a certain project that creates revenue for the locals and is sustainable. I'm going to pass this on to Lynn as far as the history of the Ugenya Banana Project, and I will chime in with my my action on it.
So just briefly, we as an organization are constantly learning, and one of the things that we learned from the Banana Project is we had given the local management team the materials to grow bananas, and so they did that, and we left it at that. We didn't ask how were they going to weed and protect the bananas and where would the money go. And unfortunately, after 3 years, we were harvesting, but before they could harvest, the bananas were stolen because we didn't have a night watchman, and we didn't have people weeding, and so it's back to you, Chris.
So my job was to go there and act as almost a consultant to find the problems and how we can fix them. So I went to the farm and I sat and spoke with the caretaker. There's one caretaker who cares for the farm, and I asked him what can be done to reduce the theft of the bananas and to increase the productivity of the bananas themselves. So I sat down with him for maybe a couple of hours, asked him a series of questions, along with some other, I guess you could say, banana experts. And so from there, I wrote a 6 to 8 month banana work plan, along with another intern named Katie Cooper. And so this work plan really focuses on addressing those issues that have been in the past and fixing them. For example, having the caretaker live there to reduce the theft from the locals, and using manure to reduce the weeds that have killed the bananas. So right now there is another intern who is carrying out our business plan and pretty much executing what we wrote down.
And that's not the only IGO.
Yeah, so very quickly, another IGO. It is located in Bacala, which is another village of hope by Soteni. So this is, it's called the soil compressor, which is a machine that creates bricks with the input of soil and very little cement. With this, you do not need to burn the bricks, which is traditional. This is better for the environment and cheaper, and it can be done on site. The creation can be done on site, which is much easier. So our idea behind this is at first to have an IGO hiring 4 local people to work and create the bricks and then sell them. And it was my job to write a business plan, write step-by-step directions on how to operate the machine and to actually train them. Katie and I trained 4 locals for about 6 hours one day until they were masters, which they are. And eventually our idea is to take these bricks, they're called interlock bricks, and create a building called the Mary Tabor, which will be a Soteni Resource Center in Bacala. So we're really excited about that.
So now that you're back and you've had some time to think about things, how would you say this experience has affected you?
Well, it definitely, I've definitely grown as a person. Before I went, I'll be honest, I was definitely more passive about trying new things. So when I went over there, I had the mentality just, try everything. I mean, you're in Kenya, might as well try things. So I carried back just a more open mind, a more willing to try new things, and which will definitely be good in the future for me.
You mentioned something about patience.
Yes, I also gained the skill of patience. For example, Kenyans do not construe the concept of time as much as Americans. For example, the first meeting over there was scheduled to start at 9:30, so being somewhat prompt, I was there at 9:30, maybe 9:32, and the meeting didn't begin until 1 o'clock. And this theme occurred throughout my journey, my experience there, so I definitely learned the concept of patience, and I'm very thankful for that.
And why should anyone else do this, be an intern for something like Soteni?
Because if you experience the same thing for your entire life, you'll never know what else is out there. For my first 21 years, I've only experienced the American culture. I thought I knew everything, so I went over there and I realized I don't know everything. I know very little, and it just opened my eyes to the world, and I think that's good for anybody because it's definitely a true awakening, and people can definitely benefit from that.
Okay, Chris, Lynn, thank you very much. This is Kirk Sinclair, the Hiking Humanitarian.